Ever thought about how sometimes adding pressure can actually be, well, a good thing?
It sounds counterintuitive, maybe.
Yeah. But today we're diving into something fascinating. Hyperbaric oxygen therapy. It's where increased pressure is actually used for healing.
Specifically, we're looking at how it helps with a really dangerous situation called gas embolism.
Right, those nasty little gas bubbles that can get into your bloodstream and cause serious blockages.
It's pretty amazing, actually. You take someone, put them in a special chamber, increase the pressure, give them pure oxygen to breathe.
And that helps.
It can be incredibly effective. So our mission today, really, is to unpack the science. How does piling on pressure and oxygen actually fight those bubbles?
We've dug into some medical handbooks, textbooks too, focusing on hyperbaric medicine to get the core information.
Exactly. And we know our listeners have a good grasp of basic science, so we're aiming a bit deeper than just the headlines.
But, without drowning in technical terms.
Right. Keeping it understandable.
Okay, so let's start right there. Gas embolism. What exactly is happening inside the body?
Well, fundamentally, it means gas bubbles have gotten into the circulatory system, your blood vessels.
And they shouldn't be there.
Definitely not. They travel along and can get stuck, basically forming little blockages, dams, if you like.
Which stops blood flow.
It impedes it, yeah. Which is especially bad if it happens in the arteries, because that cuts off oxygen supply to important tissues downstream.
Okay, arterial gas embolism. Sounds bad. How does the gas get in there, though, especially in a way that hyperbaric treatment would be relevant for? It's not like sipping fizzy drinks too fast, right?
No, not quite like that.
Hmm.
In this context, we're often talking about a traumatic introduction of gas. A key one is related to pressure changes.
Like with diving?
Exactly. It can happen from lung damage, what we call pulmonary barotrauma during ascent.
Yeah.
If someone comes up too fast after being under pressure,
Their lungs could get injured.
yes. And if that happens, air or gas can escape from the lungs and get forced into the arterial bloodstream.
Wow. Okay. That's, yeah, quite a scenario. So linking this back, if someone's just been diving or experienced any rapid pressure drop and they start showing weird symptoms.
That is a critical point. Any symptom, really, after a decrease in environmental pressure needs to be flagged.
Assume it could be gas embolism.
Assume it could be, until proven otherwise. You really need a high index of suspicion. Quick action is key.
Got it. So these bubble roadblocks are floating around. How does putting someone back under pressure, but this time with pure oxygen, fix that?
Let's maybe touch on the basics, how oxygen normally travels in our blood.
Sure. So normally, almost all the oxygen, like over 98%, hitches a ride on hemoglobin. That's the protein inside red blood
A
cells.
vein transport vehicle.
The main one, yeah. A tiny bit, less than 2%, just dissolves directly into the plasma, the liquid part of the blood.
Okay, and it's that tiny dissolved bit that becomes super important here. With the pressure. I think this is where Henry's law fits in. You got it. Henry's law basically says the amount of gas that dissolves in a liquid is directly tied to the partial pressure of that gas above the liquid.
So more push from the gas.
It means more gas dissolves. Simple as that, really. When we breathe normal air, oxygen has a certain partial pressure. But if you breathe pure oxygen and you increase the overall atmospheric pressure around the person,
Like in the hyperbaric chamber.
precisely, the partial pressure of oxygen goes way, way up. This physically forces much more oxygen to dissolve into the blood plasma.
So you're kind of bypassing the red blood cells capacity limit.
You are. Significantly. More pressure equals way more dissolved oxygen.
You have like numbers to show that difference. How much more are we talking?
Yeah, we do. At normal sea level pressure, what we call 1 atmosphere absolute or 1 ATA, dissolved oxygen in arterial blood is tiny, maybe 0.31 volume percent.
Okay.
But crank up the pressure to, say, 3 atmospheres absolute, that's like being around 66 feet underwater, and breathe pure oxygen.
And what?
That dissolved oxygen level can rocket up to something like 6.02 volume percent.
Whoa. Okay, that's not a small jump. That's huge.
It's a massive increase.
Well,
And it's crucial because once your hemoglobin is full, which happens pretty quickly.
it's saturated. Can't carry anymore.
Exactly. So this hyperbaric oxygenation, forcing oxygen into the plasma, is really the only way to dramatically boost the total amount of oxygen the blood can deliver. Especially vital if bubbles are blocking the red blood cells from getting through easily.
Right. Okay, so we've got this flood of oxygen dissolved in the plasma thanks to the pressure and pure O2. Now, connect that back to the bubbles themselves. How does this help get rid of the gas embolism? The oxygen doesn't just zap the bubbles, does it?
No,
Yeah.
not like a laser beam. But it attacks the problem from several angles. First, there's the direct effect of pressure on the bubble size. This comes down to Boyle's law, maybe not explicitly named in every source, but fundamental.
Pressure goes up, volume goes down.
Exactly.
Uh-huh.
Increase the pressure around the body, and the gas bubbles physically shrink. They get compressed.
Like squeezing a sponge or a balloon.
Pretty much. Smaller bubbles are less likely to cause a complete blockage. They might still obstruct, but less severely.
Okay, so step 1, shrink the bubbles with pressure. What else?
Step 2 uses that extra dissolved oxygen. Even if a smaller bubble is still partially blocking a vessel, the plasma flowing around it is now super rich in oxygen.
Ah, so oxygen can still get past the blockage.
It can diffuse from the plasma directly into the starved tissues downstream. It helps oxygenate areas that aren't getting enough supply via the red blood cells because of the blockage.
Like a delivery service finding a side road when the main highway's jammed.
That's a good way to put it. It combats the oxygen deprivation, the hypoxia caused by the embolism.
Makes sense. Is there more?
Oh, yes. Another really important mechanism is getting rid of the gas inside the bubble. These bubbles are often mostly nitrogen, especially if related to diving or decompression.
Right, because air is mostly nitrogen.
Correct. So when you breathe 100% oxygen under pressure, you create a huge difference, a gradient in partial pressures.
High oxygen in the blood, low nitrogen compared to the bubble.
Exactly. And gases naturally move from high partial pressure to low partial pressure.
Yeah.
So the nitrogen inside the bubble feels this pull to dissolve out of the bubble and into the blood.
And
Then the blood carries it to the lungs, and you just breathe it out. This nitrogen washout makes the bubbles shrink even more and helps them resolve faster.
so the high oxygen pressure literally pushes the nitrogen out of the bubble.
It creates the conditions for it to leave much more rapidly, yes. It accelerates the process.
Yeah.
And as we mentioned, it directly fights the hypoxia,
The oxygen starvation in the tissues.
which is the main immediate danger from the blockage.
Yeah.
This therapy delivers a massive oxygen dose right where it's needed.
It seems like a multi-pronged attack. Shrinking, oxygenating past the block, and cleaning out the bubble itself. Anything else?
There's also evidence it helps with swelling or edema. Sometimes tissues swell up after blood flow is cut off, which can make things worse. Hyperbaric oxygen seems to reduce this post-ischemic edema.
Okay, reduces secondary complications.
And potentially, if the brain is affected, a cerebral gas embolism. There's research suggesting hyperbaric oxygen can help brain cells function better, improve their energy use.
Neurological benefits, too.
Some studies suggest neurological recovery might even be quicker compared to just giving regular oxygen, especially if the brain was severely oxygen deprived.
Wow. So it's shrinking bubbles, boosting oxygen delivery, washing out nitrogen, fighting hypoxia, reducing swelling, and maybe even protecting the brain. That's quite a list.
It really covers a lot of bases.
What does the treatment actually involve for the patient? You mentioned the chamber. Is it a quick thing?
Timing is critical. Getting treatment recompression started quickly is really important for the best outcome.
So rush them to a hyperbaric facility.
As quickly as possible. A standard kind of protocol, often referenced, is the U.S. Navy Treatment Table 4.
Okay, what does that look like?
It involves taking the patient relatively quickly down to a pressure equivalent to 60 feet of seawater inside the chamber.
60 feet. Okay.
Then at that pressure, they breathe 100% oxygen for set periods. But they also have scheduled air breaks where they breathe regular air for a short time.
Why the air breaks?
It helps reduce the risk of oxygen toxicity, which can be a concern with prolonged high-dose oxygen. So they alternate oxygen and air over several hours.
Several hours at 60 feet, breathing oxygen.
And then, after the main treatment phase, the pressure is brought back down to normal very slowly and carefully, following specific decompression schedules.
That sounds pretty intense. Is that table 4 always the one they use?
It's a common starting point, especially for diving-related issues. But no, the doctors will absolutely tailor the treatment.
Based on what?
Based on how severe the embolism is, which parts of the body are affected, the patient's overall health, how they respond to the initial treatment. They can adjust the depth, the time spent breathing oxygen, the air break duration, the ascent rate. It's quite adaptable.
And is this the only thing they do? Or are there other treatments happening at the same time?
Hyperbaric oxygen is usually the primary definitive treatment for serious gas embolism. But yes, absolutely, other supportive care will be given. Fluids, managing other symptoms, general critical care support if needed.
Right, it's part of a bigger picture. Now, putting people under pressure, giving pure oxygen, Sounds like there must be safety factors to consider.
Definitely. Safety is paramount. These treatments are generally very safe when done correctly, but you need strict protocols.
Like what?
Well, fire safety is a huge one. Pure oxygen under pressure makes things much more flammable. So meticulous procedures to prevent any spark or ignition source inside the chamber.
Okay, that makes sense.
Safe handling of the gases, obviously. And the decompression itself needs to be done properly to avoid causing decompression sickness from the treatment.
Ah, right. You wouldn't want to fix one problem and cause another.
Precisely. That's why the staff running these facilities are highly trained specialists. It requires expertise to manage both the medical side and the technical safety aspects.
Okay, so let's just pull this all together. Hyperbaric oxygen therapy for gas embolism. It's using pressure and pure oxygen to do several key things.
That's right. Pressure shrinks the bubbles directly,
Pure oxygen under pressure dissolves massively into the blood plasma
which gets oxygen to tissues even if blood flow is partly blocked,
and helps flush out the nitrogen from inside the bubbles, shrinking them further.
while also directly fighting the tissue hypoxia, reducing swelling, and potentially offering some brain protection.
It really is amazing how physics pressure, gas laws, gets turned into such a powerful medical tool.
It is. Taking these fundamental principles
Yeah.
and applying them to save lives or prevent serious disability, it's quite remarkable.
It really underscores how understanding the basics can lead to really clever medical solutions, which kind of makes you wonder, given how well this works for unwanted gas bubbles in the blood, could this principle using pressure and oxygen manipulation be applied to other conditions, maybe other situations where gas is causing problems in the body?
That's a great question to ponder. You know, as we learn more about exactly how gas bubbles behave on a micro level, how oxygen transport really works under different conditions, the subtle effects of hyperoxia, it's definitely possible.
Future applications we haven't thought of yet.
Could be. Further research might well uncover new ways to leverage these principles. It's certainly an active area.
Fascinating stuff. And for anyone listening who wants to get deeper into the weeds on hyperbaric medicine, definitely check out those medical handbooks and texts. It's a field where physics, physiology, and medicine meet in some really cool and vital ways.